WHO, on the occasion of World Cancer Day, released 2 reports that suggest are an estimated 1.16 million new cancer cases every year in India.
Mouth cancer is a major health challenge for us in India, and that's because it has a very high incidence. This is because of the high use of tobacco in our country, both smoked and chewed. The disease affects patients of all ages, young, old, and from all socioeconomic strata. And sometimes patients who suffer from this and their families are devastated because of the disease, or sometimes the effects of the treatment they have to go through. The treatment of mouth cancer is primarily by surgery. This was a young male who had been treated outside previously for a cancer affecting his left jaw. As part of his treatment, the left jaw had already been removed. And while he was managing with whatever drawbacks that left him with, the challenge we had this time was that he had developed a tumor on the right side of the jaw. And we would have to remove the right half as well this time, which means effectively at the end of the removal of the cancer, he would have no jawbone. Now, life without a jawbone is incompatible, and we wanted to reconstruct his jaw so that he gets all the functions back.
At Vedanta, we see more than 200 patients in a year who have advanced oral cancer. The mainstay of these patients in terms of treatment is removal of this cancer, which means removing part of your face, that is the skin, the muscles, the bone, and also the inside lining of the mouth. Now that leaves a big gaping hole on the face, and this needs reconstruction, and that is where we as reconstructive and plastic surgeons come in.
So jaw reconstruction is a very intricate surgery. So most commonly is done by taking a straight bone from the leg and contour it in the form of a rounded jaw. So this technology definitely helps us, because the computer now decides where to cut the bone, how to cut the bone, so that it perfectly matches and blends in with the rest of the jaw. But the next step, which is also more critical, is the joining the blood vessels, because once we cut the bone from the leg and it is brought onto the face, then we have to again join the vessels in the neck to bring life to this bone flap. And this is done by sitting under the microscope, joining these vessels together by very fine threads, which are nearly the size of your hair.
So for this particular case, the challenges that I faced during the reconstruction, planning the reconstruction, was because of the previous surgery, half of the mandible or half of the lower jaw was already removed, and the other half that was remaining was not aligned properly. So in order to plan the reconstruction, before I had to do 2 things. First, I had to realign the lower jaw in order to match with the upper jaw, and also then duplicate the remaining lower jaw so that I can simulate the whole mandible with which the patient was born with. Now, with the help of the oncosurgeon, we decide the cuts, we decide how much of the mandible will be removed. So I'll be left with almost no lower jaw that will be reconstructed by the bone from the leg. This bone is then simulated or it is aligned to best match the contour of the lower jaw, so that the patient restores its function and aesthetics. This guides get attached onto the bone of the leg and helps us to reshape the fibula bone and cut it at the pre-designated position, so as to obtain all these 3 segments that I have shown for the reconstruction of the mandible.
So today is the D-Day. Today is the day of the operation. I have with me the 3D printed guides that we use for both cutting the jaw as well as the reconstruction. During the operation, we'll have 8 surgeons, 3 anesthetists, and a large number of nursing and support staff during the day with us. As the operation takes 10 to 12 hours, we have an early start. We prepared hard, we prepared well. We really hope things will go good. So wish us luck.
We have been called now. The cancer surgeon have finished their work, and it is now my turn to start the reconstruction.
So we come to the end of a long and tiring day, but fortunately the procedure has gone very well. We now move to the next phase of recovery and the next critical 48 hours in the ICU. This is a technique that we started in 2017 and have pioneered it since then, having performed it in over 250 patients.